My name is Dave Stimson. I'm the chairman of the County Board of Commissioners. We've been having town hall meetings here for a few weeks. I feel it's like a few weeks, but maybe it's been months now, I guess. And this town hall meeting this morning is in regards to the reopening of the economy. We'll have the typical format we ask people is always be professional, be polite, understand that we're recording this and sending out to YouTube and putting on the county website so that people who couldn't attend also have the ability to see it. We're going to have a couple presenters this morning. Typically, we've done this with Marty Marshall from the county administrator's office. He's the county administrator, and Martha Hall, who is the health officer for the county. They'll give us a bit of an update of where we're at with the COVID crisis. And then we're going to hand it over to an economic update from Tim Robinson and Jim Van Dorn with Lenawee Now. And then some insight on the human services side from Amy Bergman from Human Resources Tips. And so she does consulting with her company on human resources. So welcome. I appreciate everybody participating. We have had pretty good feedback from all of this. There's a chat function, so if you have a question, please go down to the bottom of your screen, use the chat function, send me a message either to the group or to myself, and we will try to get that answered as soon as possible. There'll be a Q&A section kind of in between the different presentations as well as at the end, just so we have any questions that can be answered. Please feel free to ask us. Raise your hand. There's a hand function as well so that we can call upon you, and then we'll have some hopefully good discussion. We like to try to keep these meetings fairly abbreviated in the sense that we like to keep them within about an hour. I mean, if it's a good conversation, it keeps going, but if it's not, if it's kind of follows its natural course, they tend to be about an hour long. So with that, thank you again for coming in this morning and seeing us via Zoom. And I'm going to turn it over to Martha to give us an update on resources, availabilities, reopening information, things of that associated with the pandemic. Martha?
All right. Thank you, Dave. Good morning, everybody. It is really good for us to be having conversations about reopening. That's a nice change of pace. So I'm just going to give you a quick update as far as the health department. A couple of things. Right now we are at 158 cases here in Lenawee County. That's a cumulative case count. So since our first case on March 24th, about 21% or 20% of those cases are active cases. And we do update that information every day on the health department website. If you just go to lenawee.mi.us, you'll immediately come to something to click for COVID, and that will get you right there. There's also information on that page for testing. So in Lenawee County, testing happens if you reach out to your primary care provider. Typically, they assess you over the phone and they can get you scheduled for testing. Individuals that do not have a primary care provider can reach out to the health department, and one of our public health nurses will be able to screen them and get them scheduled for testing. Adrian Urgent Care also conducts testing here in Lenawee County, and WorkSphere also does testing through their occupational medicine facility there. So those are options for testing in Lenawee County. Some of the other resources that you will find on our website are going to be things, there's a template. So every business needs to have that preparedness plan in place for COVID. So that is available there on our website. There's a toolkit there for restaurants to assist them with reopening. There are links to posters, which are going to be really valuable for people to have in facilities as we're opening. There's a general guidelines for business, as well as many other links. I'm just kind of giving you the highlights of what's available there. And as we move forward with reopening, it's going to be really important that we are all looking at those prevention strategies that are going to help to prevent the spread of COVID in our community. So, just making sure that individuals are physically distancing from each other, so maintaining that 6 feet of space. When that's not possible, using those some type of a barrier or a partition to be able to create separation. Also, that employee screening piece. We need to encourage employees, do not come to work if you're sick, and make sure that we're screening them every day. Just to make sure that, they don't have a fever and they don't have any symptoms that are associated with COVID. And then, of course, the face coverings. So those are all going to be really key prevention pieces as we move forward. And, try to keep this in check here in our community.
Thank you, Martha. Marty, you want to talk a little bit about the resources available from the county and how we're working as the county reopens?
Yeah, thanks, Dave. We have been starting the process of reopening. We have equipment, personal protection equipment, available to nonprofits and municipals on order through our printing and purchasing department. And we've also started allowing small businesses to place orders. We have to separate those orders because, one side is tax exempt and we don't pay sales tax on it, and the other side is not tax exempt and they have to pay sales tax on it. So we have to separate those orders, but you can reach out to the printing department, printing and purchasing department, and they can place orders for equipment. You can go out and look yourself. A lot of this equipment is more readily available than it was a couple months ago when you couldn't find gloves, you couldn't find masks, you couldn't find a lot of the stuff that you needed to reopen. But I will tell you that whether you're buying it in conjunction with the county or whether you're buying it yourself, you're going to find that the cost is significantly different than it was 5 or 6 months ago. Things that you could get for 10 or 15 cents, 5 or 6 months ago now cost 60 or 70 cents per item. So that's just the new reality until the marketplace catches up with the demand. Here at the county, we opened up some of our offices last week. The Human Services building opened up because the Secretary of State's office was taking appointments, and we instituted a screening process out there. Yesterday, almost all of the general offices in the county opened up. When I say the general offices, that does not include the courts. The courts are operating on their own schedule, and that's driven by the State Court Administrator's Office, which operates under the guidance of the Supreme Court. So that's going to be a little bit different program. We've had hiccups just like everybody else who's opening up. We've found that the screening process slows things down. The person responsible for the security detail out at the Human Services building told me yesterday that he had a line out the door of people. They were all on the little X's, socially distanced, and a couple walked up past them, oblivious to this line that's outside the door. And when they got inside and were told that the line was out back, they expressed how stupid they thought the whole thing was and went back and got in their vehicle. But that's going to be the way it is with business right now. It's going to be slower because of some of the precautions that are being taken. And that's something that we're all going to have to acclimate ourselves to. Plan ahead, get there ahead, try to deal with the fact that things are going to be a little different for a while. Dave?
Thanks, Marty. Next, we're going to hear from Tim Robinson and Jim Van Dorn with Lenawee Now, and I think they have a slide presentation to share screen with us. So I'm going to hand it off to Jim and Tim.
Thank you, David, and welcome everyone. We'll tell you a little bit about economic development. It's coming with its challenges. We're glad that everything's opening back up, but even from our large companies to our small businesses, we've got some real challenges. And to point that out, you'll see here on our next slide that the unemployment rate in Lenawee County, just to give you an overview of where we're at here economically, is 28.5%. As you know, in March, when this started, early March, Lenawee County was the 14th county in the state of Michigan for employment and low unemployment, for good employment and low unemployment. We were 14th, 3.5% unemployment. And at April, right now, we don't have the numbers for May. We checked with the state, but they just wouldn't release anything. They're still collecting data. But at the end of April, we were 57th in the state. We had gone from 14 to 57th at 28.2%. So, March, the United States was 4.4%, Michigan was 4.3%, and in April, the United States unemployment was 14.7%, and Michigan was 22.7%. And so, we're right up there with the high rates. With that, Randy Yagala is with us here today too, and Randy runs our talent division, but was assigned to looking at all of the programs that were coming out because they were so complex. Randy worked with RCO law with interpreting these and put them together, and I'm going to let Randy give a brief explanation of where we're at with all of the programs. And we would just want to remind everyone on our webpage, www.lenawaynow.org, there's a COVID-19 badge right on the front you can click on, and all the programs are on there. Lots of them are very difficult to manage and go through, and that's what we're here for. And we've fielded 160 plus businesses have called that we've assisted with them. And as you know, with the Michigan Business Relief Fund from MEDC, Lenawee County was allocated $187,000 in mini grants for businesses just to help them during the crisis. And when we announced that, within 3 days, we had applications for $4.5 million just in Lenawee County. So, I mean, this is really serious, and unfortunately, we're going to have a lot of our very, very small businesses that are going to have a difficult time coming out of it. So, Randy, give them a brief overview on where we are.
Thank you, Jim. Good morning. On June 5th, President Trump signed the Payroll Protection Act, Flexibility Act. It extends a lot of the timelines that were in that act, and we'll make sure we get those up on our website. But the forgiveness period was extended from 8 to 24 weeks. The ability to use those funds from June to December of 2020, and the amount that was for payroll alone dropped in your application from 75 to 60%. So that broadened your use of that, employer's use. Mm-hmm. The injury loan or SBA loan that employers could apply for was a $2 million amount that you could apply for our employers. That is now limited to $150,000. That's a big change. And it's only focused now on agricultural businesses. And the last piece is the work share program out of Leo at the state level. That continues to be something employers can access. And what's called PUC, which is the payroll unemployment compensation, continues. So that's the additional $600 per week for those that are unemployed. This work share allows employers to work at less than 100% of their workforce. They define their work unit, and the folks that are laid off get a percentage of their unemployment. So it extends the cash for the employer. It protects the jobs of those who are temporarily laid off, and they receive unemployment and some income from their employers. So if there's questions on those, please let us know, but that's the latest updates.
So again, all on our webpage, some of it very complex. We're here to field those questions. Be sure and get a hold of us. So Tim's going to run through a few slides here of what we were doing prior to pre-coronas and carrying on. We're just going to.
Yeah. Okay. Well, obviously, before all the fun, our actions were basically typical economic development, entrepreneurialism, talent attraction, talent retention, business retention, just like Jess and Chris and all the other EDs on the line here. Obviously, it pivoted a little bit. Those things stayed. What we were doing stayed, but the local business crisis support, like Jim mentioned, the small business relief program, the $187,000. We had 160 applications for that money. And then the COVID-19 business resources that Randy just went through, we've been keeping up on those so that we could advise the companies. Post. So post, buy local, as like say Chris and Jessica on the line, and our other EDs and chambers, pushing buy local. It's on our website, on our social media. We are sort of in this together, aren't we?
And you're going to see that carried on when we talk a little bit more about our partnerships, which I'll talk about next with Detroit Regional Partnership and Regional Growth Partnership. Everyone is re-strategizing right now their marketing effort along with us, which we're part of those groups, and actually are in the process of preparing for a grant to continue to help our business with that and remarketing their product lines. But we believe that, and our big partners believe, Detroit Regional Partnership and Regional Growth Partnership, that the United States will never be put in this position again. So when Tim talks about buying local here in Lenawee County, in our big businesses, we're talking about buying local and staying within the United States. So we're going to be working through our Detroit Regional Partnership, going back to the big three and those companies that are getting supplies from outside of the country and looking at bringing those back into the country. On the educational process, Randy, you want to run through that quickly right here?
Sure thing. So we're still working with the ISD in our pilot districts on our CTE, which is to make sure students, parents, counselors, and employers are having streamlined communications about job skills, job openings. Exciting, this week we published a postcard that's going to students that are graduating right now, because we do have companies that are hiring in the county, and we want to make sure they are aware of that in case. We call them gap students. That's the standard phrase for students that thought they were going to college or were in college and thought they're going back and now don't have the financial ability to do that. We want them to know that we have companies in the county that are hiring and have tuition reimbursement, so they can continue those plans. And on our MICA grant, it's a Michigan Industry Cluster Approach. That was a competitive grant. We won one of those, $170,000. That focuses on our chemical industry, which is very important to us, and focuses on their talent challenges. And we're working to create a video to market that industry to parents, counselors, students, and others. That's going along rather well. They've met throughout the crisis through Zoom meetings with Jack Townsley, Michael on our staff, and myself. So that's where we are.
So we think that's really an important part of moving the county forward, especially on the talent side, and especially right now we've been in contact with all three of our colleges. That right now the rate of dropout for the new freshman class is at 17%. And climbing. A number of small colleges have closed. So there's people today in Lenawee County throughout the whole United States that had college funds for their children to move them ahead, that had to use those to sustain a family during this time, and they're not going to be going to college. So it's an ideal time to look at the talent system and what we're doing with the talent system. So it's worth rethinking our marketing strategy. And Randy's applying for the EDA grant. Did you tell him about that?
No.
Okay.
The EDA grant application is going to go on next week or so. Lee Sherry, who's the state rep, has had 2 Zoom meetings with Jim, Tim, Sue Smith from Hillsdale. It's a joint application with Hillsdale County. It's supported by Region 2 and the funding that they are also getting. The focus is this onshoring piece that Jim talked about, product and customer diversification. And some of the things that Tim encountered with Jim is some business acumen standards. We had some businesses that really struggled applying for federal and state funding, did not have the financial reporting ability to prove their needs. So we're focusing on that, and we're very encouraged.
And Jessica, you want to tell them about site readiness?
Yeah, so we received funding from the state for our smart 8-inch Smart Zone, and that is to ramp up our marketing efforts. So that'll include some pretty robust data gathering to understand, what industries best fit here with respect to where we fit within the supply chain, both from a cluster strength standpoint, so meaning like what other industries are here, but also just from a location standpoint. And then also once we gather that information, we can make a really targeted approach to attraction and also update all our marketing materials. We think this is really good timing with this reshoring effort that Illinois now is leading. I think that this is where the country is going to go. We've already seen examples of some large companies like Black & Decker bringing their offshore manufacturing back here to the US. So we're really excited to hold this all together right now.
Thank you, Jessica. But our partners are here. Chris Miller is with us too. And when we get in the question and answer period, they're available to you. We've talked to them about that. So we'll all be answering questions if you have them. So as we're rethinking our marketing, we suggest you rethink your marketing. And if we can help you with that, a little advertisement for Hoyden Creative, they help us with our marketing, and they're happy to help anybody. They've done some terrific jobs. But if you need help with that, call us. We have resources for that, again, along with the other programs. One other, I'm going to close on time, David, you'll be happy to see, and actually a little early, but one comment I do want to make is yesterday we were on a call with our administrator, Marty Marshall, and we had a nice dialogue. We were talking about the unemployment rate and why it's staying at 28%. Well, it's staying at 28% because people are getting $3,600 a month to stay home. And so, when you stop and think about some of those small jobs and when they go to work, they're sitting there saying, well, it's summertime and I can make $3,600 a month and not go back to work. So it's going to be a challenge here. It's going to be a challenge. And as you know, the feds have talked about even extending that program into September. So it'll really become a challenge. So with that, David, we're done early.
Well, thank you guys, and thank you for all the hard work. It's been nice to be able to have partners around the county that work as well with us as you all do. So questions on the economic outlook, the update for Jim, Tim, Randy, or anybody else. So I'd open it up to anybody who's got any questions about where we're coming from and what we're doing from an economic standpoint.
Boy, we must have really been good.
Well, they gotta wake up.
Well, the good part of doing these is that I know enough of these people on here that I can start picking on people if I really but if not, if we don't have questions, that is good. And you guys were thorough with your information, so we appreciate it. So next, I'm going to turn to Amy Bergman, who's going to give us some insight on human services needs. Amy, you're the president of Human Resource Consulting, and you're going to give us an update on the human side of things, how we handle our employees.
Well, good morning. Yes, Amy Bergman with Insight HRM, and we provide outsourced HR solutions for for-profit and nonprofit organizations. I'm also the immediate past president of our local HR professional association called the Human Resource Association of Southeast Michigan. And we too provide education and information to small businesses in the Lenawee County area. So what we're talking about today, all of these technical details regarding reopening your business, and I think it's important that we spend some time talking about the human side of your business in the midst of the pandemic. It's certainly a situation that none of us have ever managed before. So once you have all of your details relative to your signage and how you're going to flow customers in and out and how you're going to manage the social distancing in your workplace, we really need to think about the issues that our employees will bring to the table. There are going to be a variety of issues that this situation causes in your workplace. So Martha had mentioned the COVID-19 preparedness and response plan. All businesses are required per the executive order to have this plan, but really, look at the template and utilize that to create something that becomes a good communication tool for your team internally. So there's 3 key areas of this plan that need to be addressed. One is how to reduce the transmission amongst your employees. 2, how the company is going to maintain a healthy business operation. And then 3, how the company will maintain a healthy working environment. And we have to remember that there are guidelines under OSHA and MIOSHA with the obligation for you as an employer to maintain a healthy work environment. This plan should also reinforce the CDC guidelines for preventing the spread of the virus. So we have to be like a broken record and continually reinforce all of the, hand washing, sanitation, cover your sneezes type guidelines and social distancing. Also, it should list the expectations and the guidelines for business operations, for employees, but also for our customers, our vendors, any visitors that are coming in and out, the entry restrictions, our protocols for cleaning and disinfecting, how we'll be training and onboarding new employees into the organization, potential travel guidelines or restrictions that we may have, and also how we'll manage exposures in the workplace, how we'll respond to those, what are our expectations for employees that are returning to work following an exposure, a presumptive positive or an actual positive COVID-19 test. So all of those things need to be rolled up into your plan. And then the next issue that is really facing a lot of employers right now are the mental health issues surrounding this pandemic, the fear and anxiety that employees are facing. They're asking questions like, what am I supposed to do? What is expected of me if a customer refuses to abide by the screening questions or to wear a face covering? Am I expected as an entry-level employee to police that with customers? Other fears come from maybe knowledge that an employee has that maybe one of their coworkers' spouses works in a higher risk population, such as a healthcare worker or a prison worker, where they have been facing higher numbers of cases, and the employee doesn't want to work with that person. They refuse to work in the same office space as that person. So we have potential issues relative to retaliation, harassment, discrimination that could pop up. Also, for those employees that have been working remotely, they may say, I've been doing this and I've been doing it great. I'm keeping my family safe. I have an elderly or an at-risk person in my household. I don't want to come back into the office. How will you manage that? Or if I'm an employee that's immunocompromised and I'm scared to leave home to go back to work. So there's several issues that will cause this heightened anxiety and fear in your employees. And I think there are ways to offer support to these. First, having this detailed preparedness and response plan is a great tool to communicate what you as an employer are doing to protect and mitigate in your workplace. And communicating this with your staff and communicating regularly with them will really help. Offering various community resources for mental health support. organizations like LCMHA, your Employee Assistance Program. There are a variety of online trainings and webinars that you can provide as resources. Also giving employees outlets to manage their stress and anxiety, such as wellness activities. Think about restructuring their workday, maybe staggering their start times or staggered shifts, offering more breaks, a chance for people just to get up and stretch and walk around a little bit. Those are great stress relievers. Provide reassurance that your organization is following the CDC, the OSHA, and various health department guidelines and all the recommendations from our governing bodies. And then finally, to address fears, ask questions, inquire what your employees' specific concerns are, and seek suggestions from those employees regularly, and then implement when those are reasonable, because a lot of times the employees are the ones that understand exactly what could be done differently and more creatively to alleviate some of those concerns. Another area of heightened interest and hot topic for the HR world is remote work, and considering bringing people back into the workplace if you have been allowing folks to work remotely. So first and foremost, conduct an evaluation for those remote workers. Which positions do we really need to require to bring back into the office today? I think there's somewhat of I'll call it an old school philosophy that your butt has to be in a chair in an office in order to be productive. I think the last 3 months have proven otherwise. So which positions could we continue in a remote environment for a few more months to help mitigate the spread, or potentially indefinitely? But also asking these employees who are working remotely, do they prefer to work in the office, or do they prefer to work from home, or maybe some sort of mixture of both? Because I think there's a lot of opportunity there to meet the needs of different folks. I know a lot of people that have never really worked from home before that are anxious to get back into the workplace. They don't like working from home. They feel isolated. Others are loving it. So I think it's good to find out, what do they want? Because you don't want to bring everyone back into your workplace, into your office space all at the same time. So staggering the return of employees, maybe consider 2 days a week, and then offset that with somebody else the other days of the week, so that you're limiting the number of people that are flooding back into your facility and help prevent the spread of the virus. And then providing some additional resources for making remote work really work for those that intend to make it a longer term arrangement, including make sure that you have a solid telework policy that has the expectations listed for what you as an employer expect from your employee. How many check-ins do you want from them? What types of results do you want them to have on a regular basis? And then keep them connected with your workplace. So things like this, like Zoom meetings and other types of web platform meetings, are really important to keep people connected. Even quick little water cooler conversations, a 15-minute check-in, passing of high fives and kudos to people, those are all beneficial to keep people connected. And then making sure that managers and supervisors are having consistent one-on-one sessions with their remote workers like they would in a regular office space. So those are some considerations for the remote work environment. Other areas of concern related to compensation, I think employees that have been working the front lines all along in the essential businesses are somewhat frustrated. They have seen their friends and family members who are collecting unemployment and basically staying home and staying safe, probably making more than they are on the front line, and they're coming into work every day. So how will you be appreciating those that have maybe served your business all along? And it doesn't have to be in the form of cash bonus, a $1 per hour raise, or anything like that. There are numerous ways that you can reward and recognize these team members. So consider finding out what motivates them and what they would appreciate. Conduct a survey, or just ask, what are you motivated by? What gets you excited? You may find that some employees just want, some extra paid time off later to use when things settle down. Maybe they want some grace and being able to come to work later or leave early to attend family functions, or just be able to make it to that new outdoor exercise class that they've been eyeing. Things like that to give a little flexibility can go a long way. But also, creative things like gift certificates for a haircut, or to grab some carry out, or to, go golf at the local golf course, things like that. Things to make them feel special and appreciated. Either way, it's really important to not turn your back on the folks that have worked through all of this crisis time for you and your business, and helping you keep things going. Essential workers really deserve a ton of extra love right now, and especially because so many others have kind of benefited from the unemployment system right now, and they're a little bit tired and stressed. So don't forget to reward and recognize those folks. So we talked about using the COVID plan, the preparedness or response plan, as a communication tool, and really providing regular messages to your team regarding what you're doing to keep the workplace safe, what you expect of employees, what's happening with your business, how are you changing the way that you're operating. Different types of things like that are really important to keeping employees connected and understanding what is expected of them. There are a lot of ways that you can communicate with your team creatively. It doesn't have to be pulling everyone into a large conference room, which is a big no-no right now. So think about utilizing your phone or an app on your computer to record a quick 60-second video update and push that out. Or there are a plethora of text messaging services where you can blast text messages to your team, kudos, appreciation, updates, changes to business, things like that. Use all hands calls, conference calls or web meetings to pull the team together. Of course, the old school memos and emails are still effective too, so make sure you do that. But keep them brief and provide regular updates. Make sure you're addressing questions and answers that may have come from your team, and lots of appreciation. And you can't reinforce enough the expectations of the CDC guidelines for reducing the spread and mitigating the virus. So just try to pepper that into all of your different forms of communication, utilizing all of those excellent tools that are already prepared for you on the County Health Department website as well. Some other issues that your employees are dealing with, those that have childcare needs, that's been a real issue in this area. Many childcare providers, in-home and centers had closed. And so some staff are going to fear taking their children back into a group environment, such as a childcare. So think about how you might be able to flex your schedule, your scheduling of your staff to help them with their childcare needs. Maybe provide your employees a list, a childcare sort of checklist for employees to use to vet out how prepared those centers are for welcoming children back in. Are they doing all of the state required safety measures in their child care center? But are there ways that you can be more flexible with your staff to give them an opportunity to maybe ease back into work while juggling childcare? So maybe they've been home for 3 months with these kids, and they don't want to flip a switch and just dump them 40 hours a week back into a child care center. That's really scary to them. So maybe you could spend a few weeks easing them back in a part-time schedule so that they can have their child care for, a more relaxed schedule for a period of time. The kids are going to have anxiety too, and that is another thing that employees are going to be dealing with. So after their parents have been home with them all this time, preaching to them, we can't go to the playground, we can't go visit your friends because of this virus. and now all of a sudden we're going to push them out into a public environment, into a child care center. That's scary to the children too. And that, of course, will create additional stress and anxiety for your team. So be sensitive to that. I think if nothing else, be sensitive, because how you're feeling and reacting to the situation is going to be very different from, you know, everyone else. Everyone has their own set of issues that they're managing and dealing with. As you're working through planning your staff and understanding that you're going to have turnover in this environment, whether it's people refusing to come back to work or they don't have the opportunity to put their kids in childcare for whatever reason. So be prepared for the potential turnover, the need to recruit and hire new folks, but think about how you're going to train those new employees in this new restricted environment, because you know, you can't have them sitting shoulder to shoulder with someone else to shadow for 2 weeks. So there's got to be other ways to train them, whether that be utilizing various paperless onboarding, like through different HR portals that allow you to do a lot of the things you would do in orientation, you can do electronically, Zoom-based or other web platform-based instructional training where you record different demonstrations of things and have employees view that via the computer. Of course, the recruiting environment is going to be very different. So if you're not comfortable utilizing a webcam and a platform like this, you need to get yourself comfortable with that if you're going to be recruiting, because a lot of what you need to do, at least to initially vet out candidates more effectively in this environment, is to utilize a web and phone interview skills. And as we're looking at staffing planning, you know, plan for some employees to have more extended leave needs. They may have been on a leave of absence for a period of time, and that may extend. You know, there's protections under the FFCRA that was passed back in March. So they may have job protected leave, so you may not be able to fill that position permanently. You may need to look at other creative staffing measures, such as temporary help instead of full-time regular help. But you can also get creative. You can consider outsourced solutions, contract work, or maybe share resources with another business that's facing the same type of challenge, and maybe you have a really skilled finance person that you can share with another business that might need some help. So I think there's a lot of things you can do on the staffing side of things to do differently, but to maybe be more efficient for your business. And one issue that a lot of folks have been asking me about are the employees that are refusing to return to work when you're ready to recall them. Maybe they've been on leaves, furloughs, layoffs, whatever you've labeled it, but now you're ready to restart and you need your employees back and they're refusing to come back. So what recourse do you have? Well, if fear is the only reason that they're providing for returning to work, the employer really can take terminating action if necessary, and then contest unemployment claims for a refusal to return to work with really no basis other than fear. It's up to the unemployment insurance agency to make those determinations, but I think employers that have proper documentation of the mitigation that you've done internally, the communication, the documented job offer of returning to work, most likely the employer will prevail on those cases of unemployment claims. If childcare is the reason that employees are refusing to return to work, remember that you'll need to follow the FFCRA guidelines for providing extended leave relative to childcare if your business falls under the category that's required to offer that, and work through any of those compliance issues prior to taking terminating action. And of course, there are other legitimate issues relating to protections under the Americans with Disabilities Act and other types of protected classes that you'll need to vet out before you take terminating action, just to make sure that you're not violating any employment regs. But it's really important for the employer to enter what's called the interactive process, which is to have dialogue with the employee to find out and determine what, if any, accommodations might be able to be made before denying a request for an extended leave or some sort of work variance, like working remotely, before you take terminating action. And I guess the final area that I think bears some discussion are travel restrictions. So the previous executive orders provided a restriction for interstate as well as international travel. And as these things begin to loosen as part of your preparedness and response plan, I suggest that you create a travel policy now and then massage it along the way so that employees are well advised in advance. We're coming upon the summer season where people like to, take road trips or travel internationally with their families, and you want to give them time to prepare. Because in the past, or under the previous executive orders, employees were required to quarantine for 14 days before returning, to interacting with the community and interacting in the workplace. So you want to pay attention to the CDC website and the other resources for where are the virus hotspots for level 2 and level 3 advisories, both domestically and internationally, and communicate that to your employees. Or perhaps you may just not be comfortable having your employees, going on airplanes and things and then coming back into your workplace and potentially spreading virus internally. So you want to have a travel policy on that you continue to revisit and recommunicate. Many people had spring break trips and things that, to Aruba or Jamaica or wherever that they postponed to the summer. So they're getting ready to kind of get back to normal and go back on those travel plans. So how is that going to impact your business? And if you allow them the 10 days off for travel, are you going to require them to quarantine for another 14 days and in essence be off work for 3 weeks? So these are the types of issues that you're going to be dealing with on the employee side of managing your business. And I'm certainly a resource to you. My contact information is available to you, but also my colleagues in the HR Association are also available, and I'd be happy to answer any questions that any of the participants today may have. Thank you for giving me the opportunity to share some ideas.
Well, thank you, Amy. It was a lot of information. We appreciate it. Questions for Amy in regards to any of the information that she put forward? Well, all righty. Okay, we're back over to a non-shared screen so I can see everybody's faces again. No, we try to put a lot of these programs together, these town halls, for questions and answers, both from Martha and Marty and myself. But this is a different one with having Lenawee Now and Amy kind of present some information specifically to our small businesses and our large businesses across the county and some of the issues that they're having and resources available to them. The county has been attempting to be a resource all along with the way we handle things. I know Martha's office has tried to put up guidelines and plans, and one of the things we talked about was, that COVID return preparedness plan and kind of a template that's available and the resources available to that. So if you've got questions for any of them, please feel free to ask.
Hi there.
Hey, is that Brandy?
This is Brandy Archer.
Hi, Brandy.
I've got a question. Per the 6 feet kind of guidelines that we have right now, when reopening with the 6 feet, is that, like, for instance, I have a dance studio and my idea is that even if dance studio's open, but I have to keep kids 6 feet apart, I still can't reopen until that 6 feet is lifted because we can't really do our job. Is that at the business owner's discretion via parent discretion, or is it I cannot be in business unless they are 6 feet apart? That you know.
Brandy, I think it's a good question probably for Martha to answer, as she is astute as you can probably come and how we're doing social distancing with the crisis. Martha?
Yeah, so that is a really good question. So when we think about that physical distancing piece, we know how important that is, and especially when we're doing any kind of physical activity where there's potential that we're going to be, breathing harder, pushing out more air and more of those respiratory droplets. So it is, as far as the dance studio piece, that part the guidance has not come out for that yet. So I don't know whether that is going to be a requirement for the 6 feet of physical distancing. In many of the other documents, it will say something like physical distancing where possible, or trying to put, other things in place, maybe to go along with the physical distancing. So I hate to not give you an answer, but I do believe that some of it is going to be dependent upon what those requirements are when the
at that time.
when the order comes out that changes that.
Because I did see a list for June 15th for dance studios, gyms, etc. That being one of the things that opens, and I was like, well, I can't keep these kids 6 feet apart. That makes no sense for us because we're creating art. So I when that comes out, I just didn't know if I was missing any information. It could be they don't have to be 6 feet apart if they are masked or gloved, or So I guess something new should come out then. I guess before the 15th with those guidelines.
Well, and that piece for the 15th, I believe that is for regions 6 and 8. I would have to go back and look at that executive order again.
The specific areas then.
Right. So
what are we?
Yeah. So we are region 7. For the Jackson region.
Okay.
And I believe that what changes for us on the 15th is the personal services. So haircuts. Yay. I think all of us will be really excited about that. It's personal services. It's haircuts, tanning,
Taxes,
nails,
things,
massage.
Individual. Got it.
Yeah.
Okay.
So I believe, and Brandy, I'll be glad to take a look at that and verify that.
Okay.
But that was my understanding, was that was just that those other items that I believe it's executive order maybe 115 that talks about those other things opening, and I believe that those other things are for regions 6 and 8.
Okay, that's really good to know, because now I know to look for region 7. That pertains to us.
Yes, we're the Jackson region.
Okay. Well, thank you very much.
No, thank you, Brandy, for the question.
Artha, can you talk a little bit about the difference between inside and outside? We're getting lots of conversation with our restaurants about outside dining. We've got that 100-person limit on groups. And could you just talk about that difference and what's okay and what you need to do in order to contrast that inside and outside piece?
So the inside gathering is still 10, I believe, and it's now 100 for outside. Still, of course, trying to maintain that physical distancing where possible, and wearing a mask if we're unable to maintain the physical distancing. As far as the restaurant capacity, what the order states is that they can open at 50% capacity. So whatever capacity that establishment has been approved for, that's what they would be allowed to reopen at 50% of that.
And how about the outside dining, which is being added? Is that also going to be at a 50% capacity? Because that's obviously a lot different animal.
The outside part of it, so I can tell you that there are many who are interpreting the 50% to mean 50, that's the cap, 50% of whatever your normal occupancy is. I agree that the outdoor piece, it is a different something. Keeping those tables, making sure that everybody from various parties is staying at least 6 feet apart is going to be that critical piece. Not sharing common, things, which, it's going to change the dining experience. So, not having condiments coming out to the table, perhaps, that are going to be shared, or menus that are going to be shared, all of those different pieces. So it is going to look very different.
And Dave, if I can just follow up on that for a minute. With our partners, Chris at Adrian City and Jessica at Tecumseh, and Martha will certainly include you. We are planning a town hall series here in the very near future for any restaurants and eateries, because we have all of the best practices and the bad practices that happened up in the Traverse City, Leland area when they first opened up. And we have all of those examples. And so we're, with Adrian and Tecumseh and the health department, we'll be having that town hall series. If anybody knows a restaurant or eatery that should be involved in that, please let us know or let them know to contact us.
Thanks, Jim. Other questions? There was a question posed in the chat, Martha, I guess back to you. Essentially, what should we do if an employee and their family test positive or their family test positive for COVID during the reopening period? You want to reiterate the protocols for a positive test?
Absolutely. So whenever there is a positive test or an individual that tests positive, the health department reaches out to them, and we try to do that very quickly. We reach out to them, and one of the big things that we're going to do in that contact is to find out who have they been in contact with starting 48 hours before they started showing symptoms. And then we're going to start making contact with those contacts to let them know what they're going to need to do to try and prevent the spread. So I can give you some general terms that for the most part, someone who tests positive is going to be not returning to work until they are at least 3 days without a fever, without using any medication to reduce that fever, and it's been at least 10 days since their symptoms started. That's the general. But they are in contact with a public health nurse very regularly, and that public health nurse is going to take the information that they're providing to them and make a determination as when they can return back to work. They are given a letter from our office that says they have to isolate at home and that they are not to leave home. And then when they are released from isolation, they are also given a letter that says you're good to go. So for those contacts, it is in general terms, again, it is your 14 days of being quarantined. So staying home for 14 days and monitoring for symptoms. And after that time period, if the person doesn't develop symptoms, then they would be able to return to work. There are some things, I'm giving you general terms, but think of this one example. If you have a household and somebody tests positive, the 14-day quarantine for those other household members is not necessarily going to start in the very beginning when that case is identified. That 14 days is going to be from the last time they had contact with somebody who's considered to be a positive case. So they could end up being out for a longer period of time. Also, sometimes what happens is one person, has it in the family initially, and then somebody else develops symptoms. Well, there we go. We start all over again. So sometimes it can be a lengthy process, and it's hard to give you just a straight, that it's going to just be 14 days and this is how it works, just because there's so many variables, and we really just have to have conversations with the people and understand what's going on. Credit to the Lenawee County community. We have done just a great job of being able to minimize the spread here in our community. And I really believe that is because people, for the most part, have taken this seriously and, have stayed home when they've been, given the information that that's what they needed to do. So does that help, or do we need more clarification?
I think that's a good answer.
Okay.
Appreciate it, Martha. And you should give you and your staff kudos. The other day you provided us statistics of percentage on reach outs for contact tracing of health departments across the state, and where our particular health department locally was ranking in those percentages. I don't recall them off the top of my head, but it was about 2 to 3 times higher of of a contact within the first 24 hours, within contact for the people that those individuals had. You should be proud of the staff and the work that they've done. We were very, very good and very, very proactive in getting that contact tracing done.
Well, thank you. And they have done a great job. They take it very seriously. I see there's another question about.
Amy's got a hand up, it looks like.
Whoop. Okay.
No, that's just a clap. I'm not good with it. Okay, good job. Go ahead, Martha. You should do a question.
There's a question on public restrooms in public buildings. It says, is there guidance yet on the use of public restrooms in public buildings? I've seen private businesses close restrooms, but public buildings are different. So the public restrooms, if you're going to have those open, and that always, it gets a little tricky because, you know, there are requirements that say you have to have your restrooms open for certain buildings, for certain businesses. So what I would really encourage is that a couple of things. Make sure that there is signage so that you are reminding people to wash their hands. I know we've all heard it so many times, and we're probably tired of hearing wash our hands, but we do still need to really drive that message home. Cleaning and disinfecting the faucets, the door handles, all of those high touch surfaces, those common surfaces is going to be really important. So I would increase the cleaning in those, you know, especially those high touch areas.
Thanks, Martha. Thanks for the question. It's been about an hour. Do we have any other questions? We received a lot of good information this morning. Again, thank you, Jim and Tim and Randy and Amy for the presentations this morning. It was very helpful and very informative how we're handling some of these things and what to look forward to as we begin reopening the economy. Thank you for Martha, again, for the expertise within the health department. And everybody, again, for showing up. We really do appreciate that. There's a lot of information at the county website. If you just go Lenawee County, Google it, Bing it, search it, Yahoo, take your pick of search engines. You'll find it very, very quickly. And there's COVID links that are you cannot miss them. They are very prominent. Jim, you had one more comment?
And Dave, just for you and Marty and Martha, I think on behalf of all of us, we appreciate the leadership from the county. You guys have been very reactive, putting these programs together on a regular basis, and we very much appreciate it.
Mm-hmm. Well, we take that to heart and appreciate hearing it. So we try to work very hard to do a diligent effort. Sometimes it's received. If you follow Facebook, we're probably not received as well in the comment section. But again, appreciate everything and have a nice day.
Thank you.
Thank you.